globally, cancer is just an alarming public health challenge. I mean, think about it. 2022 alone, nearly 20 million people diagnosed. And tragically, almost 10 million deaths from cancer-related causes. Those numbers, they really underscore the critical importance of early detection, through cancer screenings. We know these screenings save lives. But, well, what if the biggest hurdles aren't the ones we usually think about? So for this deep dive, we're exploring a new study that really tries to unpack why people do, or sometimes don't, engage with these vital screenings, especially in places with low participation, like breast cancer screening in Turkey. It's around 30–35%, when the target's actually 70%. Big gap. Yeah, and this study, it's from researchers in Eastern Turkey. It offers some really fascinating insights into what's going on underneath. It really focuses on two key ideas: health literacy and health fatalism.
Health literacy and health fatalism.
Okay.
Yeah, think about it like this. Someone might have all the facts about screening, right? But a really deep-seated belief about fate, maybe that could still stop them from getting care that could save their life. That's the kind of powerful, sometimes hidden influence this study brings to light.
Okay, let's unpack this then. What exactly are these concepts, health literacy and health fatalism, and how did the research actually connect them? So let's maybe start with that first one. Health literacy. What do we mean when we say someone has or lacks health literacy?
Essentially, it's about your ability to first find health information, then to understand it, and critically to actually use that information to make good decisions about your health.
Right. So it's not just reading pamphlets, it's comprehension and action.
Exactly. And it's absolutely vital for using preventative services like cancer screenings. If you don't really get why screening matters, or maybe how to even access it, you're probably less likely to do it.
And the study found a clear link there.
Oh, definitely. That's a crucial point. What's really compelling from the data in this study, and it lines up with lots of other research too, is just how strong that connection is. People with higher health literacy, significantly more likely to participate in screenings. The data showed a clear, statistically positive effect. It really highlights it as a foundational factor.
So it's not just about information being out there. People need to be equipped to engage with it.
Precisely.
Okay, that makes a lot of sense. Now let's look at the flip side. Health fatalism. This sounds deeper, maybe more like a belief system.
It is. Health fatalism is basically the belief that your health, maybe life events in general, are mainly controlled by external forces like destiny or fate.
So a feeling of having no real control.
Exactly. If you hold that belief strongly, you might feel like you have little or no personal say over your health outcomes, regardless of what you do. And connecting this to the bigger picture, you can see how that belief could really stop people from seeing the value in early detection, even when we know how critical it is.
So why bother getting screened if you think it's all predetermined anyway?
That's the core of it. And the study found exactly that. High fatalism correlated strongly with low screening participation. Someone with that mindset might actively avoid screenings, thinking they're pointless. It's a really significant psychosocial barrier, like you said. It's rooted in beliefs and attitudes, not just a simple lack of knowledge.
Right. A mental hurdle. That seems incredibly challenging to address. But, so, okay, here's where you said it gets really interesting. This study didn't just look at these two things separately. They used this method, latent profile analysis.
Yes, latent profile analysis. It's a clever statistical technique.
Right. It basically finds hidden groups in the data.
Exactly. It lets you see if people naturally cluster together based on certain characteristics. And they found two very distinct groups or classes based on these factors.
Okay, tell us about these two profiles they found.
Yeah, this is where the study really shines, I think. It shows these aren't just abstract concepts. They shape people into quite different groups regarding health. So class 1, they called it high health awareness. These individuals had high health literacy, generally positive attitudes about cancer screening, and crucially, low health fatalism.
Okay, so they have the knowledge and the belief that their actions matter.
Precisely. They're equipped and empowered, essentially.
And then the other group. Class 2.
Class 2, which they logically termed low health awareness. This group showed the opposite pattern. Low health literacy, more negative views on screening, and high health fatalism.
Wow. So it's often a combination of factors locking people into certain behaviors.
That's what it strongly suggests. These clear profiles, they really raise important questions for public health, right? How do we tailor interventions? And interestingly, these findings align well with global strategies, like WHO recommendations. They also stress the need to tackle these psychosocial barriers, like fatalism, not just push out more information or focus only on literacy.
So the big takeaway here seems pretty clear then. If we genuinely want to boost cancer screening rates and ultimately improve public health, it needs to be, well, a two-pronged attack.
That sounds right.
We need to improve health literacy, make sure people can find, understand, and use health info. That's vital. But just as important, we need to actively find ways to challenge and reduce those fatalistic beliefs. Beliefs that tell people they're powerless over their own health. It really comes down to empowering people, giving them a sense of agency.
Well said. It's about addressing both the how-to and the why bother.
So thinking about this, what does it all mean for you, listening right now? Understanding these concepts, health literacy and health fatalism, it gives us a really powerful way to think about promoting health, not just in specific regions like Turkey, but really anywhere. It highlights that it's about so much more than just giving out facts. We have to consider these deeper beliefs.
Yeah, maybe take a moment to consider, in your own life or maybe in conversations you have with family or friends. How much control, how much agency do we really feel we have over our health? Is it something we can influence? Or do we sometimes feel like external forces are really dictating things?
It's a really provocative thought, isn't it?
Yeah.
How our own belief systems can either open doors to proactive health choices or, well, build walls against them, even when potentially life-saving information is right there. Makes you wonder what other parts of our lives are shaped by these kinds of invisible internal forces.